Hey, in this video I'm going to show you how to stop patient drop-offs easily and ethically in a cash-based physical therapy clinic. So as always, don't forget to subscribe using the button below. You'll get exclusive first access to weekly content as well as free CPD courses to help you become the go-to therapist and build that go-to clinic. Now, if you don't know me, my name is David Sullivan. I've worked in professional sport for over 13 years, and alongside that I've been very fortunate to build up a private practice while also being able to work in sport. And again, you do that by designing your business with the end in mind. So we're very fortunate in Huddersfield in the UK to have a go-to clinic, and I can go to Australia or Japan, like in the pictures here, for a World Cup and leave the clinic running and continue to build that go-to therapist reputation. So here is what I've learned about how to stop patient drop-offs easily and ethically. Now, this is human behaviour, okay? You go into a program, whether it's you come into a mentorship or you come in for physical therapy, you're excited at the possibilities, okay? So the initial assessment, the patient is excited, okay? That's great, yeah. You ask them all the questions, they're motivated, that's great, okay? They leave the clinic, reality, life gets in the way, okay? So that half an hour, that 45-minute session, it's a tiny percentage of the 24 hours a day that they have and everything else that's going on in their life. Whereas we tend to think sometimes that we're the center of the universe and the patient is constantly thinking about doing their exercises, blah, blah, blah. That couldn't be further from the truth, okay? So they leave the clinic, they start to doubt themselves. They might be influenced by other people, among many other things, okay? They might get some wins, okay? Then they get pain again, the pain returns. They might do too much, then they start doubting whether the exercises are helping, etc. Then they get another small win, this doesn't work, and they go through this cycle throughout. Again, this is human behaviour, just modified to physical therapy, okay? And then hopefully we can get them the results they want, okay? So we have to be aware that this is probably going to happen, okay? Louis Gifford in Aches and Pains talks about this, like, people think that it's just going to be this linear progress, when in reality there's a rocky road. So how do we manage this session 3 to 4 patient progress slump, okay? And this is usually where it happens, where you might do some hands-on treatment and the patient feels a bit better, they leave, feel a bit excited. But when they come in sessions 3 or 4, usually that kind of novel stimulus that we're placing with our hands, or the hands-on treatment, it's not as effective now. It's not sticking, or the techniques you did in session 1 or 2, they're not having as much of an impact. So how do we get around that? Okay, so again, we work smarter, not harder. So when we look at what the patient wants, we can see that acute patients coming in with acute conditions are higher satisfactions than people with chronic conditions. So the chronic conditions, we have to set expectations, okay? So they recommend that in this paper, meeting patient expectations will improve satisfaction ratings. So if we want happier patients to get results, reviews, referrals, retention of these patients in the future, we have to give them a good satisfaction experience, especially in cash-based physical therapy, where we have to provide even more value than we charge in return, okay? So unrealistic expectations of change often were associated with people less satisfied. So the patients that weren't satisfied, a lot of it comes down to skill, knowledge, professionalism, friendly attitude, effective communication, and the ability to provide a helpful explanation about the patient's condition, the ability to give prognostic information, how many sessions realistically it's going to take, and the ability to explain the patient's role in the treatment plan. Okay, so ultimately, how do we do this? So the patient experience in private practice, attributes of a common experience of or common good experience, effective communication, and the patient's perception of the high quality service. Okay, bad experiences relate to service quality, so the type or the impact of the treatment. Okay, so again, the treatment, they didn't feel like it was helping them. Okay, and the physiotherapist communication to be efficient. So you can see this word communication coming up time and time again. And by addressing patients' expectations, we're not only promoting patient-centeredness, but also it's building rapport. So how do we do that? So the aim in the initial assessment, if you don't want to have this session 3 to 4 patient slump, we need to be setting expectations in the first session. And this formula will never keep you too far wrong. Patient expectations minus current reality equals patient level of happiness. Okay, so if the patient's expecting one thing and they're getting something else, you're probably going to have a very unhappy patient. So we want to get that patient expectation and reality as close as possible. Similar, okay, cash-based physical therapy, if you're charging this much and you're only giving this much value, you're not going to probably have a happy patient. So we want to give a lot more value than we charge a payment. That's going to equal a happy patient. Okay, so setting expectations, as I've covered in a previous post, what are the most important questions? What's the most important thing you want from today's session? That's in the initial assessment. Okay, so now what we got to do is we got to go, right, how do we manage the expectations in sessions 3 to 4 when the motivation's starting to drop, etc. Okay, what can we put in place? Okay, so does this make sense so far? I hope this is all making sense. If it is making sense, pop a yes in the comments, followed by your biggest takeaways so far. That just helps me make sure that I'm explaining this content properly and that you're able to take this information and implement it in the real world so you can get results to become the go-to therapist and build a go-to clinic. So if it's making sense so far, pop a yes in the comments along with your biggest takeaways so far that you maybe have reflected on or that you might take action in the clinic tomorrow. Okay, so what we really need to do, okay, is we need to find what the pain is stopping the patient from doing. Okay, so if we go back to our graph, you can see they might get a little bit of pain, they get a little bit annoyed, or they start to doubt themselves. I wonder if I can do this. So we need to get progress. Okay, we need to get some quick wins with the patient. Now, ideally, we need to get those quick wins, okay, that are also going to be long lasting. Okay, so I'm not talking about using some kind of exercise that, you know, rub your belly and pull your air and we short term increase your range of motion. I'm talking about helping that patient see progress. Okay, because if a patient is making progress, they're not going to start doubting themselves. Okay, so again, we need the patient to feel and see the progress, and that goes all back up to the type of impact, the quality of service, okay, the impact of the treatment provided. So we need the patient to see and feel the progress. So what we want to do is this concept of 6 hours versus 6 reps. What can we do to give this patient an opportunity to be successful and get progress? Okay, so when we do that, we're not now thinking about 6 reps of an exercise. We're actually thinking about what the patient needs to be able to do throughout the day and wants to be able to do. Okay, we need to appreciate that. You know, the first steps is there's some easy wins we can get with the patient, but it all goes back to this concept of focusing on the person in front of you rather than just exercises. Okay, so that's so important that we can understand that. So where are the opportunities to get some wins? Okay, so the rehab exercise that you're prescribing, are you having the patient lie on their back for 6 reps, or are you building your exercises into their daily life so that we can give them some stuff that they can do throughout the day so they can notice and feel the difference in everyday life to get back to what they need to be able to do and what they want to be able to do. Now, the next thing is, how do we manage this 3 to 4 patient progress slump? Okay, so at the initial assessment, again, we're going to draw out the plan. Here's where you are, here's where you want to get back to. This is the plan. And then in the last 5 minutes of the session, we want to recap. Okay, this is now where you are. This is where you what I want you to do this week. The reason you're doing these exercises is because then this next week we're going to get back to hopping, and then the following week we're going to get back to running. So you can see the patient knows they've made progress. Okay, they can see the progress, they can feel the progress, and then they understand clearly why they're doing what they're doing this week and what's to come. Okay, so that they know there's more progress to be made. And most patients are going to drop off due to a lack of or actual perceived or actual progress. Okay, so again, I'll say that once more. A patient will usually drop off because of a lack of progress or a lack of perceived progress. So they might be making progress, and you and I see this every day where patients do really well, but they feel like they haven't made progress. Okay, you can tell objectively that they have. So that's where the perceived progress is so important. Okay, so again, we need to address these objections. We need to show them the progress they've made. We need to show what they're doing this week, why that's going to get them to the next stage, to bridge that gap to where they want to get back to. Because ultimately, we're just designing a graded exposure program to get them there. So every week they need to still continue to progress. Okay, so again, how you're going to be able to do that is you need to understand how to design a treatment plan from the initial assessment all the way through. Okay, and again, working in professional sport, I'd be very lucky to have to design these programs, especially the high level rehab, when the manual therapy starts to slow. Okay, so at the Go-To Physio, we spend a lot of time looking at what's not doing its job versus the symptoms. So we still respect pathology and symptoms, but most of our time is spent actually getting everything else doing its job to ultimately give that person that buffer, that capacity to thrive in the real world. And that all starts with having that step-by-step system. So in the mentorship program, module 1 is the subjective. We get really clear on what the patient wants to get back to, and in that subjective assessment I actually go into what do they need to be able to do, what do they want to be able to do. And if you're not very clear on what that patient's life looks like, their daily life, then you're not going to be able to design your rehab programs around their daily life. You're going to go back to the old way of just giving them generic exercises that you're relying on motivation. If you're relying on a patient to do motivation, or if you're relying on your patient to, I'll say that again, if you're relying on your patient to do exercises, okay, then you're going to be absolutely lost, because we know that exercise compliance is not very, very common. So we cannot rely on their motivation to get their stretching band, to get their foam roller, to sit down on the floor and do a lot of exercises. We have to build our exercise routine into their daily life, and that's where the 6 hours versus 6 reps concept comes in. Okay, what does progress look like, and let's give it to them. Okay, so again, the exercise compliance is not very common because of the perception of their symptoms. Okay, so again, effective explanation will take care of that. Assessment of the effectiveness of their interventions. So that's where, again, we always recheck. So we test, we use a KPI, we intervene, and then we retest the KPI before the clinician, or before the therapist, before the patient leaves, so the clinician knows that we haven't made the patient worse. Okay, I can't tell you how many times I've done that until I started checking my KPIs. Then the ability to incorporate it into everyday life is so important. So we can get them that first logical step, they can see the progress, and then every single session then they come back and we recap on where they are, because again, that's only a 30 to 45 minute session. They need to be recapping to ultimately get them back where they are. So in the initial assessment, as I said, we get really clear on where they want to where they want to get to. You can see here motivation levels and self-esteem. That's also going to be very, very important. And then also, it's so important, the effective communication, that I actually have a special bonus on this as well. Okay, so the effective explanation is something that we do for every body part. We understand what their motivators are, and we give them a very, very simple explanation of how we're going to get it back to what they want to get back to. So it's so important. Okay, so the ability to have that step-by-step program, because what a lot of therapists do is they're given exercises here, and after session 3 or 4, the exercises aren't bridging the gap to the real life. Okay, so again, the patient's progress stagnates, they don't feel the progress, they don't feel the impact of it, motivation starts to drop anyways at this level. Okay, so you can see the motivation's already dropping. So what we need to do is we need to bridge the gap and keep the patient progressing every single session. And that all comes from not having one rehab exercise or not having a special hands-on technique that you give to every patient. It happens by having the 8 pillars of the Go-To therapist, from the subjective assessment to making sense of that objective assessment through the personal story that you get from the subjective, having a very clear communication and a plan of action with pillars 3 and 4. That all comes from the information you get from the subjective assessment, and then having your hands-on treatment and your progressions of your graded exposure to keep the patient progressing. So we're not just relying on our hands-on, but we can continue to progress the patient every session. Then we need that pillar of bridging the gap from low level to high level rehab, which is essentially module 7 onwards in the mentorship. This is how we bridge the gap from low level to high level rehab. Okay, and then you need your strength and conditioning, or your strength and your building resilience. Okay, so again, we bridge the gap in the back half of the mentorship. So the initial module 1 subjective assessment, we get really clear on where they want to get back to, what progress looks like, okay, their motivation levels, how we can get a rehab in throughout the day, and especially the first few modules, whether it's lower limb, upper limb, cervical, lumbar, we're very, very conscious of getting these quick wins. But then when the manual therapy isn't as effective anymore, okay, when you can't rely on that or those low level exercises to bridge the gap from low level to high level rehab, that's where modules 7 to 12 come into their role. Okay, and then ultimately that gives you that go-to therapist reputation, because you have the confidence and clarity to understand why you're doing things and keep that patient progression every single session. Okay, so if you want to know more, if you want to learn how to make this specific to your situation, feel free to head over to thegotophysio.com/strategy/call. Myself and my team will go through this with you. We'll show you exactly what we do, how we say it, and we'll make it specific to your situation. Okay, so head over now to thegotophysio.com/strategy/call. I'll put a link into the comments as well, and we'll show you exactly how we do this specific to your situation. I hope you found that useful. I'll see you next time.